syndrome, and then ultimately he died because of that, unfortunately. And the hematological complication includes the immunosuppression, include thrombocytic, thrombotic, thrombocytopenic purpura, which occurred in 2 patients, and we only had one patient who had a graft dysfunction after implantation. So there is no death related to surgical technicalities like hepatic artery thrombosis, portal vein thrombosis, or bile leak, or there is outflow obstructions. So we had a lot of complications because these patients are immunosuppressed. The infection is the most common complication we encountered in our data set, 58.8%, followed by effusion, re-exploration, minor bile leak. We encountered 3 rejection in our patient who were responded quite well with the steroid pulse therapy. We got 6 biliary strictures which were managed by an ERCP and percutaneous transhepatic biliary drainage. We got only 2 hepatic artery thrombosis, and in which we re-anastomosed the artery, and patients were doing well, and we didn't encounter any portal vein thrombosis in our patients. In the last, the donor outcomes, there is no donor mortality reported in our center in these 51 patients. And there is a minor wound infection occurred in the 4 patients. There is a transient hyperbilirubinemia occurred in the only 4 patients, followed by effusion. We encountered 1 patient who developed depression after the transplantation, but he was managed with the reassurance and counseling only. And we got 1 patient who developed pulmonary embolism, which were managed with the conservative management, heparin therapy, and all this. So we didn't get any donor infection, COVID-19 infection in our post-operative period. However, we got one COVID-19 patient in our recipient, but unfortunately he expired because of the multi-organ failure syndrome. So this is a long journey which we started from 2014, and then we established our center, we restarted our program in 2020, and then almost we have re-established, and there are a lot of help, unprecedented support from our seniors, from Chief Minister Singh, Murad Ali Shah, who supported us a lot, who gave us a fund for needy patients, Professor Saeed Qureshi, Professor Saad Niaz, Professor Faisal Saoudar, who is the leading transplant surgeon, or the first transplant surgeon of the Pakistan, Dr. Sol Rao. And we are very grateful to our team, which includes the paramedic staff, ancillary services, who made our dream successful, especially during the pandemic area. So we achieved that milestones. We achieved that milestone after their supports. So thank you very much.